Hi there, how are you today?
Very well, thank you.
Wonderful. My name is Dr. Matt. I'm going to do your medical exam.
Okay.
Can I please verify your first name and your date of birth?
Yep, my first name is August, and my date of birth is the 1st of August.
First, okay. Wonderful. So I see here that you're a first-time patient at our clinic. Thank you so much for choosing us for your medical exam today. Can I go ahead and gather your medical history and just get to know you a little bit before we begin?
Yeah, sure.
Do you have any allergies?
Cats and hay fever.
Okay. Any allergies to medications?
No, not at all.
And in regards to your medical history, do you have any hypertension, hyperlipidemia?
No.
Any history of kidney disorders?
No.
Any history of breathing problems, lung problems, COPD?
I have asthma.
Asthma, okay. And are you under any medications for asthma?
I take the brown and the blue inhaler.
Okay.
So the preventer and the reliever.
Okay. And how often do you take it?
Brown one, 2 puffs in the morning and the evening, and then the blue one, rarely.
Okay. When was your last asthma attack?
When I was like 7.
Okay, wonderful. Okay. Alright, so go ahead and tell me what's going on today.
So I get this pain in my shoulder. It comes and goes. So it could be around for like 3 days and I can barely lift my arm. And then it disappears and I'm fine. Today it is quite painful. And yeah, it just kind of comes and goes, and sometimes it's on that side, but it's mainly on this side.
Okay, so you have the same kind of pain in both shoulders, but today is just this one that flared up, sort of. And for how long have you had this type of pain?
Probably since I was 18, so like 10 years.
Okay. And have you ever been diagnosed with any neurological disorders?
I have tried trigeminal neuralgia, and that's it.
Okay. Any neurological disorders in your family history?
No.
Okay. Any history of arthritis?
My dad has arthritis, yeah.
Okay. Are you experiencing any other pain in your body? Not right now, but throughout the year?
My hips get quite painful. Similar, comes and goes.
Similar.
And that's it. I've got a bit of an issue with my knee at the moment. It's quite a lot of pain that I experience.
Okay. Alright, so let's go ahead and just take your vital signs and we'll go from there. I will definitely examine your shoulders and just make sure that I'm not seeing anything broken or any ligaments that were stretched. Have you exercised vigorously lately?
No.
Any stress that you are under?
I would say I've probably always under a lot of stress, like consistent.
Okay, so let's go ahead and see what we can do today, and probably we'll need to find something that you can do in the long term so you can relieve the pain.
Okay, thank you.
Okay, so on a scale of 0 to 10, how would you rate your pain right now?
Right now, like a 2. When I move it, it's like a 4 or a 5.
Okay. And does it come and go? Is it constant?
It's constant for like a week and then it goes.
Okay, and for how long does it go away?
Sometimes months, but on average, like maybe 4 weeks.
Okay. And how would you describe the pain? Is it dull? Is it achy?
It's achy. Yeah.
Okay.
Yeah, it feels like an achy pain. Like it almost feels inflamed.
Okay. Any tingling sensations around the spine, on your fingers or your toes?
I do get some tingling on my back and down one side, but
Okay.
I just mainly put that down to anxiety.
Okay. Is this arm okay for your blood pressure?
Yeah.
Perfect. Okay, so go ahead and relax. Okay, can you please uncross your legs for me?
Yeah.
Perfect. And I'm going to... Okay, so go ahead and relax. Take a deep breath in. Okay, so your blood pressure is 104/64, which it is a little bit on the low side, but I'm not expecting for a person your size to have, like a textbook type of blood pressure. It is perfect as long as you're not experiencing any symptoms of dizziness or anything like that. And your heart rate is 64 beats per minute, so that tells me that you're very relaxed and your heart is not working too much to pump up the blood throughout the body. All right, I'm going to take this away. Okay, so as looking at you, I'm noticing that you're pretty relaxed. You're not experiencing extreme pain, so that's good. Is it okay if I listen to your heart and your lungs just to rule out anything?
Yeah.
Okay, so I'm going to first listen to your heart. Please relax. Okay, now I'm going to listen with the bell. Okay, and can you please take a deep breath in and breathe out? Good. Take a deep breath in and breathe out. Perfect. I'm going to listen to the sides as well. Just lift up one arm. Perfect. Take a deep breath in and breathe out. Perfect. And on the other side, take a deep breath in and breathe out. Okay, so I'm not hearing any signs of pulmonary edema, no infiltrates, normal heart sounds, no extra sounds, and no murmurs. Let's go ahead and just take a look at your shoulders. And I'm noticing that you are guarding a little bit on this side, and it could be due to the pain. Just gonna go ahead and put the hair back. Okay. Okay, I'm going to examine first the shoulder that you're experiencing the least pain, and I'm going to make some movements with the shoulder joint. Let me know if you feel any kind of discomfort.
Okay.
Okay, so just relax. Okay. And I'm going to push the shoulder back and up. Good. Okay. Can you please squeeze my fingers? Okay, perfect. And can you please show me exactly where you feel the most pain?
Here.
Okay. I'm going to make some movements. Let me know if you feel any kind of pain. So first we're going to put arm up, just level, perfect. Any pain there?
A little bit, yeah.
Okay. Back to base, and now we're going to lift it this way, 90 degrees. And any pain here?
Yeah, a little bit there.
Is it more intense on this side as we're lifting it in 90 degrees?
No, it was worse the other way.
Okay. And now I'm going to push it back. How's that?
Fine, no pain.
No pain. Okay. Okay. Okay, now we're gonna go ahead and make some movements again, and I'm looking to see if I hear any crepitus, any bubbling sounds. Good. And 90 degrees. Good. And now to back. Okay. I'm going to test your neurological responses. Go ahead and relax for me. Let me know if you feel any kind of pain. And on the other side. To compare, and if you can just relax your arm like this, that's perfect. Okay, great. And what I'll do now is to check your sensitivity. Let me know if you don't feel anything, and I'm not going to poke too hard, so just a little bit. Did you feel that?
Mm-hmm.
Did you feel that equally on both sides?
It was a little bit stronger on that side.
Okay. Do you feel this?
Mm.
Do you feel this?
Yeah.
Okay. Do you feel this?
Mm-hmm.
Alright, so now we're going to go down the muscles. Any feeling here?
Yeah.
Any feeling here?
Yeah.
Good. Any feeling here?
Yeah.
Okay. I'm going to create a vibration sound, and I'll put it on the bony prominences. Let me know if you feel any kind of pain.
Okay.
Okay. Can you please tell me when you don't feel the vibration anymore?
Now.
Good. Same thing. Tell me when you don't feel the vibration anymore.
Now.
Good.
Now.
Okay. And we're going to compare.
Now. Now.
Good. Let's find that spot. Perfect.
Now.
Good.
Now. Now.
Okay. thing. Can you please tell me when you don't feel? Did you feel that? Okay, so I'll create a motion and just tell me if you don't feel me touching you. Was that good?
Yeah.
Okay. And we're going to compare. Was that good?
Yeah.
Okay, perfect. Okay, so what I'm going to do now is I'm going to just try to manipulate the shoulder joint. Let me know if you feel any kind of pain, okay? Okay, take a deep breath in, please. 1, 2, 3. Good, and breathe out. And I would like to do the same thing on the other side. Is that okay?
Yeah.
Okay. Okay, go ahead and take a deep breath in for me, please. And breathe out. Perfect. Okay, and now I'll just focus on this shoulder. Okay, just apply pressure on the joints. I'm definitely noticing how the scapula is a little bit lower than on the left side. And we need to lift up the shoulder. Take a deep breath in. And out. Okay. Okay, so what I'll do now is apply some acupressure on the most major points, and that will start healing the healing process a little bit faster, and we will decrease the inflammatory process. Okay, so for that, what I need you to do is to lift up the shoulder. Perfect. And this way we open up the joint. Okay, I'm going to take some measurements and really assess how inflamed the right joint is. 39. To 26. Okay, August, can you please flip this side for me? Perfect. So I can have a better visualization of the left shoulder. Okay. 18, okay. Okay, so go ahead and just face the wall for me so I can definitely see this shoulder again. And what I'm going to do is to take some measurements. Are you experiencing a lot of discomfort as I'm touching you?
No.
Okay. And would you say that the pain is really deep and localized?
Yeah.
Okay. Okay. So what my guess is that it's something inflammatory happening inside the joint, and that really affects the muscles that are supporting your shoulder joint. What we could do today is to really get in very deep and massage that joint very well, also the muscles and the ligaments that are surrounding it.
Okay.
Now this might feel a little bit painful, but I'll try to be as gentle as possible.
Okay.
But with that, we will be able to release all the toxins, and we're going to help the joint feel better.
Okay.
Perfect. Okay, so I'm going to start just by gentle palpation and massage with fingers, and then I'll go ahead and use my knuckles to go really deep in. Go ahead and relax. This might feel a little bit cold. Okay, can you please take a deep breath in as I'm doing this? Good. Okay, next time when you take a deep breath in, hold it in for 3 seconds. Take a deep breath in, 1, 2, 3, and breathe out. Is it okay if I go in the back and do the same thing?
Yeah.
I'm also going to do an exam of your spine. Can you please take a deep breath in? Okay. Push one shoulder back, two shoulders back. Perfect. Okay. And now just bend a little bit forward. Perfect. And I'm going to palpate, starting with the cervical spine. Okay, I'm not feeling any bulging. Okay, so no signs of scoliosis, which is great, and your curvatures are also within normal. No deviation to the right or the left. It's perfect. Okay, so let's go ahead and just do some manipulations of the joints, and for that, I'm gonna just push in the back on the scapula. If it's too painful, let me know, okay? I'm going to start gently and then just push a little bit harder. Okay, and I always like to equilibrate things, so I'm working on both shoulder joints in the same time. Perfect. This might feel a little bit cold, I apologize. And I'll be working on your thoracic spine as well, which definitely is connected to both shoulders. Let's go ahead and release some of that tension. Any pain there?
No.
Okay. Can you please just sit up a little bit more straight? Perfect. Okay. what I'm going to do, August, is I'm going to apply some kinesiology tape. This will help reduce inflammation and pain, and I'll definitely put one tape over here so that it pulls the muscle back to the joint. I'll also apply one in the back. Okay, so go ahead and take a deep breath in. 1, 2, 3. Good. And same thing on the other side. Take a deep breath in. 1, 2, 3. Perfect. Okay, so I'm gonna have you turn back and let's go ahead and discuss. Okay, so what I was able to do is to apply this tape. It will definitely help keep everything together. Also, I did some joint chiropractic moves a little bit, and hopefully I was able to decrease the inflammation that is going on in that joint. Now, I do believe that you would need another session for sure, and you would definitely benefit by wearing a sling for a day or two. Would that be okay?
Yeah, that's fine.
Okay, so what this will do is just to allow the joint to fully recover the next 24 hours. Okay. This will go perfect like that, and place the arm in this position and the arm in this position, and just let it all relax.
Okay.
Do you have any questions for me?
How long do I leave this on for?
So just when you go to bed, take it off.
Okay.
It is not mandatory. It's more to relieve the symptoms.
Okay.
So if you do take it off, it's not going to break anything because you have no bones broken.
Okay.
That's for sure. And the ligaments seem to be very good. It's just an inflammation that is going around in the muscles that are surrounding your joint, and that's what is causing your pain.
Okay. All right. Thank you.
You're welcome. All right, so I'll see you back soon. Just make sure that you make another appointment in about a week, and we will focus on your other shoulder.
Okay. Thank you so much.
You're welcome. Have a great day.
You too.